Residents or workers in extended care facilities account for almost two-thirds of the deaths from COVID-19 in Massachusetts. It's one of the health disparities likely to be addressed by a future task force to be appointed by the state legislature. And a set of recommendations for long-term care has already been put together by the Pioneer Institute. To discuss them is the Institute's Senior Fellow in Healthcare, Barbara Anthony. Thank you very much for being with us, Barbara.
Great to see you, Chris.
Barbara, I want to roll back before the pandemic set in because these are facilities that had problems already, didn't they?
Well, some did. I think the look that we took showed that about a third of them in Massachusetts had 1 or 2 star ratings from the federal government. The federal government oversees nursing homes as well as State Department of Public Health. And so no, there were a good chunk that had pretty low grades. But it wasn't just those homes where this pandemic ran wild. Actually, it didn't matter whether you had a 1 or a 2 star rating or a 4 or 5 star. You were subject to the virility of this pandemic, and your residents suffered accordingly. So it wasn't just the homes that didn't get great ratings. It was even the better homes where the pandemic ran amok.
Where common ailments have often been fatal for residents. So you would think there would be a certain amount of vigilance about infections and controlling that.
Right.
Why was the pandemic so different?
That's the great question, isn't it? We know that, there's a lot of answers to that question. My sense is that there isn't any one, silver bullet type answer. First of all, let me make clear that under existing regulations, nursing homes should have been ready for an epidemic or in any kind of horrible infectious disease. Under existing regulations, they were supposed to be ready, but they were not. Now, there are a lot of reasons for that. Some of them are financial. They're supposed to have enough equipment on hand of the proper kind. That was not the case. As you remember, there were news reports about homes not being able to get the appropriate kind of PPE in order to create a barrier, in order to control the infection in their ranks. There's also an issue of once the infection got into a home, you had spread in the home where workers who were coming into the home from outside in the community were carrying the virus inside. They had not been tested. If you remember, again, back at the beginning of this, and even now, testing is such a big issue. We couldn't test residents, we couldn't test staff. My understanding is that testing of staff was also voluntary, and I'd like to know a little bit more about that. So we had people coming in from the outside in the form of staff. We had shut off visitors, but they had also brought it in. Then what happens inside the home? Well, when you have a horrible infectious disease like that, you need to isolate, number one. And how did homes do that very well? I think that if we look at the data, we have to conclude that they did not. And we know from the horrible events at the Soldiers' Home in Holyoke that that was not the case because non-COVID patients were mixed with COVID patients. That's part of the report that the governor had done. My sense is that the isolation within homes across the Commonwealth did not take place rapidly enough or as firmly enough. Now, how does a nursing home isolate? Well, you have to have the space to do it. If you have 2 floors, then you can put COVID patients on one floor, non-COVID on another. You only have 1 floor, then there has to be some demarcation lines, but you must isolate. The next thing you have to do is you cannot let staff who work on COVID patients then go ahead and work on non-COVID patients, and that definitely happened. Now, that is just a recipe for total disaster. People coming in with the disease, inappropriate isolation, not insufficient equipment of the right time. And I'm not talking about right type. I'm not talking about those little surgical masks that we all wear now. I'm talking about the N95 masks and those masks that are required of frontline caregivers in order to protect them from the virus and also to help to protect others from getting it from them. those masks were not available in nursing homes. They are maybe available now, but they were definitely not available at the beginning. And then you had, you know, lack of appropriate isolation. I don't know why the state was so slow, frankly, in just jumping on this, because we knew from as early as February that from the Chinese experience that seniors, the elderly in particular, and the elderly with vulnerabilities, elderly with underlying conditions, were especially susceptible if they caught the disease. If they got it, it's real hard for them to get better, and most often they don't. So we knew that that was happening in February. I don't know what took us so long to put some kind of plan together. Ultimately, there was. The state sent out the National Guard, as you know.
I imagine most of these facilities had a doctor or some nurses who understood the importance of something like isolating the residents. But what was missing as far as making it happen? Was it focus? Was it their lack of clout?
You know, I think it maybe all three, probably depend on the facility too. These facilities are supposed to have an infection preventionist. That's the name of the position. And that person's supposed to be in charge of making sure that infections are prevented, you know, with stringent infection control. Well, clearly, whoever that person is in each of those homes, maybe the positions weren't filled, they were part-time in some cases, they didn't have the clout that they needed, they didn't have the funds that they needed to buy the equipment that they needed. And the other thing, I just want to harp on the testing piece. A nursing home might want to have their residents tested, but early on, that was just not available unless you were showing symptoms. If you were showing symptoms and you were already sick, I mean, frankly, big deal, you got to be tested. By that time, half the home was infected, and only those people who were sick got tested. Finally, the state decided, gee, we really need to test everybody in a home to get a lay of the land here. What I'm saying is that the inertia, the lack of making it a top priority. You know, I spent many years in government, Chris. I'm both on the federal and the state side, and sometimes in high management positions. And I can tell you, if you want to get something done, you can get it done. But it has to be a priority. You have to be, you know, in the face of the people who control the purse strings and the authority to make something get done. My own sense, unfortunately, is that it was not a major priority. There were other things going on. I mean, that's why one of the things that Pioneer called for in our letter to this committee that's being established to study and make recommendations about COVID is that there be one person placed in charge of COVID with respect to nursing homes, and that person have no other responsibilities. You don't have to control 10 other agencies. All you're going to be in charge of is nursing homes, and you're going to report directly to the governor. And you're going to give that person the clout that they would need in order to get the job done. So in terms of that's how we make priorities. I mean, it's not that difficult. It's frankly common sense. And we didn't do it.
Well, now that you've already been harping on testing, what about testing in the future? What should that be like?
You know, I wish I could give you an answer. Now, that there may be an answer. I've not been able to find it out. That this is, you have put your finger on the next most important question is, what are we going to do in the future about testing? Is there a plan on the part of the Baker administration, the Department of Public Health, to revisit these homes again and to have residents tested and to do something about requiring that staff be tested? I don't know the answer to that question. And if there's public information about it, it has eluded our ability to find it. There has not been any announcement recently that I am aware of that testing will be done again. And it is the ultimate question, testing on both residents and on staff. And I just don't know where the state is in that regard. If they are leaving it up to homes, let me just finish that.
Mhm.
Homes have to be monitored. The state has to make sure it's done, but they also have to make sure that the homes have the resources to get the testing done. And that may mean more money for some homes.
And of
So,
course, to make this even clearer, nursing homes are not cloisters. I mean, there are people who come in from the outside world. There are delivery people. There are staff people. There
right.
could be staff people who work at other facilities.
That's,
So
that's another issue, correct.
how do you manage that?
Well, let's take delivery people and so on. First of all, everybody should be screened and temperature taken and a questionnaire before you come in. And you know, visits should be very short. Delivery, here it is, goodbye, see you later. Same with any kind of repair, absolute necessary repairs. In terms of visitors, I think that that has been opened up now a bit. And I think we have to be very careful. Visitors have to be screened with temperatures and questionnaires. And we also have to have the names and addresses of all these people so that if an outbreak occurs, we can go back and track. And we need to know where they are and where we can find them. So you had a third item too, Chris.
Oh, no. Well, that was about the sort of the migration of hazard. But one other thing here, and maybe this is sort of a big picture question, is there a culture of low expectations, especially for facilities where you have public reimbursement streams?
Well, you know, if you look at what's happened, you might conclude that just because of what the data shows. Here in Massachusetts especially, that I don't know if it was low expectations or it just was not high enough on the radar screen of the people in charge. You know, we emptied the schools very quickly, didn't we? We sent all the kids home. That was good. You had to do it. I know there's a lot of controversy about that. But we have teachers, we have administrators, you have everybody, lives are at stake as well as the kids. Secondly, we closed the colleges. You know, the dorms are closed. I live across from Harvard Law School. Harvard is not opening, not this whole the whole fall semester, 6 graduate schools. They are not opening. So we are protecting people we want to protect, and we know how to protect. Now, you can't send people home from a nursing home, but that means you have to do other things. You have to isolate. The same things we said before. You have to have the equipment. You have to have the testing. It's harder. It's going to cost money. But where are the priorities? Where are the priorities? And I just think that, you know, there's this feeling, and I have read it on social media, unfortunately, and I think it's a small minority of people who have the idea that just because you're old and in a nursing home, well, you're going to die anyway. So whether it's COVID or something else, I mean, does it really matter? And I can't tell you how upset that makes me when I see that on social media, but I have seen it, and it's ignorant and it's stupid and it doesn't make any sense. But I think that somewhere there's a bit of a culture there that doesn't place older people at the same level of priority. We say we do. Let me make it clear. We sing a great song when it comes to the elderly. We do it really well. But actions speak louder than words. Actions speak louder than words. So, you know, I think the focus was not there. I think that it wasn't so much low expectations for nursing home operators as the residents were not placed in a high enough tier of priority by our state government. I mean, we know how to do things when we want to.